Welcome to Overdose Awareness Day, Support Not Stigma, 2021, and we all meet again. So for those of you who don't know me, my name is Karen Lomax. I'm the Overdose Prevention Coordinator at ARCH, HIV/AIDS, Resources, and Community Health. For this year's event, the committee wondered if I could come up with another speech for Overdose Awareness Day, Support Not Stigma. Well, let's hope so, or it's going to be a long hour. For those of you who do know me, I know you're not concerned about any quiet time. When you're passionate about something, there's always lots to say. First of all, let me thank you for coming here today. Last year, I stood in front of you, and I remember thinking how powerful this event was, and how proud I was to belong to a city that's trying to take care of its own. It's not an easy gig. Then toss in a pandemic just for good measure. Today, August 31st, is International Overdose Awareness Day. It is a day to remember our loved ones, whether it be family, friends, acquaintances, or the unknown. We remember their smiles, their laughter, their sorrow, and most of all, the pain and the struggle as they fought to continue. As they fought against addiction, and then to top it off, they had to fight against deadly substance. Knowing that the substance that they had to use to take the sickness away, the physical pain, the emotional pain, could be completely deadly. What a horrific thought. In 2020, there were 2,100 opioid-related deaths in Ontario after the COVID-19 pandemic hit in 2020. Between the months of March and December, according to a report entitled Changing Circumstances Surrounding Opioid-Related Deaths in Ontario during the COVID-19 pandemic, this report found that 1 in 6 of the deaths occurred among people experiencing homelessness. Research say 139 people died of opioid-related overdoses in February of 2020, before the province declared a state of emergency. They say the number of deaths ballooned in December 2020 to 248 deaths, the highest monthly opioid-related death toll ever recorded in Ontario. It's heartbreaking, just heartbreaking. I hear folks say they just need to get it together. They just need to pull up their bootstraps. They just need to get sober, and life will be so much more better. So what we're saying is, if you're sober, your problems go away. You get sober, your homelessness disappears. Last time I checked, it's not how it works. We put such pressure on folks to get sober, and when they fail, we shame them. We call them names. We tell them they are dirty. And we certainly don't want them in our backyards. Heavens no. Until we fix why folks are using substance, this will continue. It may even get worse. Let's take example, a pain patient, widespread pain, dispensed an opioid. They take the medication as directed. Over time, they need more and more opioids. That's how most opioids work. They ask for an increase, and then they're told, sorry, we're seeing signs of addiction. I'm not comfortable with dispensing that high amount. We're going to cut you off today. As of right now, there's no more refills. You're on your own to go into opiate withdrawal. Medically, it won't kill you. But let me tell you, it doesn't feel like that. It's like having the flu, but 100 times worse. And you have fluid coming out of every orifice. The pain is unbearable. I'd go through childbirth before I'd go through that pain, anxiety, that hell again. Don't forget, they were put on this medication for a reason. For a pain issue that was bad enough to require a medication. But that all gets thrown out the window because we're showing signs of addiction. Instead of throwing our hands in the air and saying, sorry, you're cut off, how about working with the issue? We know there's a chance of addiction. Be prepared. Have protocols in place. If somebody is diagnosed with an illness that causes widespread pain, and this is going to be a lifelong problem, have mental health supports in place. Have a plan if addiction becomes an issue. We can't just dump people. I tell you, if I had $1 for every person that's told me this story, I'd be a rich woman. If it sounds like it's personal, it is. That's my story. That's what happened to me and many others. We have to come up with other answers for folks. We have to have protocols in place. There are a number of things that could have been done, like a daily medication dispense, a long-acting opioid like methadone, and something for breakthrough pain. Not just, sorry, you're cut off. When we do this to folks, we send them to the streets to look for their medication. And if they're lucky, they'll find a source with opioids that is familiar to them. And if they're not, they're introduced to fentanyl, and they start the dance with the deadly substance. And the spiral begins. It takes a ton of money to purchase street drugs, and once the money is gone, we have to find ways to make more money, and we do. Unfortunately, the first people in line to watch this and witness this spiral are our families. We lean on them as hard as we can. We become selfish, self-centered as we fuel our addiction. Families get sick and tired and tell us we need to leave. We're not welcome until we get better. At this point in time, we are alone on the streets, and so street life begins. We learn to live on the streets. We receive a new family to use with, a new family to show us the ropes and how to survive. You may be standing there listening to this and thinking, what do you mean? There's supports in our city. There's housing, there's social services, there's disability. We have all kinds of safety nets to help folks. And you may think, I know we do because I pay taxes. I see money deducted weekly from my paycheck, as do I. I see money, as do I. There are those things in place, you're correct. But do you know how much a person gets on Ontario Works? A single person gets $700 a month, if they're lucky. For food, for housing, for personal needs, for transportation, for their everything. Ontario Disability gives around $1,200 if they're lucky. For housing, food, personal needs, clothing, for your everything. And now you're saying, gee, that's not so bad. That's quite a bit of money. Maybe so, but the average rent in Guelph for a one-bedroom apartment is about $1,400. And the room is around $700. Now forgive me, I'm not a mathematician nor am I an accountant, but if you're receiving $700 per month or $1,200 per month and your rent is $1,400, there's a slight hiccup. We have to do better and we're not. If you're looking around this crowd, you probably, as I spoke those words, you probably saw heads nodding, saying yes to what I'm saying. Because a lot of the folks that are standing here today see this on a daily basis. These are the folks that have to give hope every day that things may get better. When the reality is the system is broken, and without an overhaul from our provincial and federal governments, it won't get better. And then we scratch our heads and wonder why folks are addicted. I'll tell you why. It takes the pain away. It takes the reality away. It takes the hopelessness away and makes it all bearable. Just like yourself, when you've had a rough day, or a rough day at work, or with the kids, you sit back when things are quiet, have a glass of wine, or a bucket of ice cream. Well, my friends, drugs do the exact same thing. It helps. Hopelessness, the disappointment in ourselves, the pain we have caused our families, drugs makes it bearable. The drugs numb us. So how about sobriety? We say folks need to get sober to fix it all and send them away to treatment. First of all, how do we know that's what folks need? And why do we think that's the only option? The problem is they go away to treatment. They come back from treatment. They're still homeless. They still can't afford rent, and they still can't find a place, and they can't eat. And now they're sober, and their coping mechanism is gone. All because society says that's what they need. And when sobriety fails them, they feel like they have failed, and so the cycle starts all over again. Relapse is inevitable. With one exception, in their mind, they have just confirmed to themselves and their families that they can't remain sober, and they are a lost cause. It's total setup for failure. Without the support and aftercare, housing, and the funds to give the ability to live, it can feel totally redundant. We just can't say sobriety is the only option for folks. We need to stop stigmatizing methadone programs and look at them as an option. We also need to realize that they are not going to work for everybody. Folks need treatment options. It's not a one option fits all. People need support. They need basic needs, and in all fairness, deserve basic needs. We are here in Canada and need to be supporting our most vulnerable. And in all fairness, I'm not just talking about folks that use substances. I'm talking about low-income households, which include folks with disabilities, folks using substance, the working poor who have to choose between rent or food, and of course the elderly. It's a shame what we give folks and expect them to find a way to live off and wonder why addiction is a problem. We need to change now before we are in such a mess we can't possibly dig our way out. We need housing for folks. Everybody deserves a home. We need mental health support for folks that use substance. We need to have a living wage. We need to realize that addiction is a health issue and we need to treat it as such. Before we lose folks to the deadly substances that plague our streets. Thank you. We'll now go in. Oh, go ahead.